Now we're going to look at this articulator's motion and do a couple cusp tip tracks to see if the behavior matches our expectations. So what I've done is I've placed two sets of arcs around each condyle position. So this one is centered around the right arc with the big rings, and this one is centered around the left condyle with the tighter rings. And if we view these perpendicular to the plane that the condylar paths are inclined in, so we're going to look down on it from this direction. So not straight down from the horizontal plane, but from the tilted plane of the condylar paths. And we'll hide this top element here. We can examine these trackers and see that in the front, where there's just protrusion, we have a straight line going forward, which makes sense. And then in our right and left excursion, and let me slow that down a little bit so it's not so choppy in the video. So in our left excursion and our right excursion, the tracker falls within the arc of each condyle. If we zoom in on the second molar, we see the same thing. We get a straight forward and protrusion, a much more lateral movement in the excursion that's on the same side, and then a more anterior movement for the contralateral excursion. So we get more protrusion on the right side in the left rotation movement because the arc is more aligned with, well, if you're watching this video, you probably already understand that. But the point is that the trackers that I placed on this spot on the cusp and then superimposed the rings around each condyle, the movement tracks make sense. So here's the second molar track. Here's the premolar track. And we can see that towards the extremes of the articulator movement, the simulation starts to break down as this track starts to exit the center of our expected arc. And that is a whole other discussion for why that's happening, but certainly every articulator is an estimation. And so I want to go over that limitation that this is probably not precise enough for large fixed rehab, and it was never intended to be, but it is a pretty decent linear semi-adjustable articulator. And then finally, here's the canine, which I think it's interesting that, in the canine, the contralateral excursion ends up being almost perfectly aligned with the mesiodistal of the tooth. And another little interesting point is if you count the color, it's blue, green, yellow, red, but coming from the other side, they're actually out of order in the radius from the tooth cusp to the condyle. So I just find that very interesting. It's like the incisor and the premolar are about the same radius away from the contralateral side, whereas when you're moving from the ipsilateral side, they're much more evenly spaced. So from that, I'm going to say that our articulator does match our expectations in terms of its behavior, and that in the extremes, towards the extreme of the movement, the simulation does break down just a little bit. and I believe that gets more significant the further away from the condyles we get. So you can see that up here we're almost out to the border of our little 1/2 millimeter guide, but more towards the posterior we're just slightly off the center. And I guess there are reasons for that that I think the closest analogy is in your physical articulators. These little pins have freedom of movement this way because with the Bennett angle and with these tracks being linear, you could never rotate around a single condyle. The articulator would bind. So these have to be able to slide from left to right to allow a pure rotation. And I've reproduced that as much as I can within the limitations of the simulation. But if you look at the non-rotating, if you look at the condyle that's supposed to be sitting still, a tiny bit of movement is being created here by the simulation. And that is, I believe, the source of that little bit of error that you're seeing in the extremes of the simulation. Okay, thanks for watching, and we'll talk about how we use this in our splint design next.